Good morning from CathySheaSchool.com. So what I wanted to help you with as a way to make what's invisible visible during your colonic session is to show you with the use of this sink and the device what's going on when you're on the fill cycle versus the empty cycle. So the name of this video is Hydrodynamics, because we're dealing with hydro, which is water, and the movement, the dynamic movement of water. So we've inserted the speculum into the client, or they have done it, depending on their choice. We have removed our guide and thrown it away. We have connected, holding our water line, connected the waistline back and forth a few times, gently tugging, not this, gently tugging to make sure it's secured. The client has turned over, they're sitting on the blue tie, and we're making sure there's no pinch in that water line, which would prevent the dynamic flow of water. So now that the client has turned onto their back, the device is on the empty cycle, and we're going to turn on the flow control all the way. And we are rinsing the rectum. So the water is going into the speculum and out through the device, but in this case, of course, it's going down the drain. And perhaps the sigmoid up here will open and you might see feces or gas. Remember, the sigmoid flexure has to open before you'll see any waste material coming through your device, okay? So if the water's clear coming through the tube, it's just the water going back and forth within the rectum, rinsing and waiting for that sigmoid to open. So we go through our body scan, we give them time to gently relax. Remember, this water is touching the sacral branches of your vagus nerve, which is your nerve of parasympathetic relaxation. So we give them at least 3 to 5 minutes, maybe longer if they came in and they were very activated. This also gives you time as a therapist to settle, ground, and balance yourself before you start the fill cycle. When there's agreement for the fill cycle, the control of the water flow right here gets completely turned off. The waste control gets set from empty to fill. And then you're turning on your flow, watching your needle on your pressure gauge, so that you are just allowing what we call the SloFil method, gentle flow of water, for 6 seconds. And then after you've counted down from 6, the flow of the water goes off and the client is holding that 1 cup of water. When they feel ready, maybe after 30, 60, 90 seconds, depending on what you observe, then you will turn your flow back on very slowly. In fact, it even says it right on the device. Open slowly, staying in the green. SloFil, SheaWay, counting back from 6. Remember, the counting is also helping your nervous system. And turning off again at the device. I put little red nail polish on the tip so you know which way to go with this, okay? And I put white on this one so you know which way to go on this. Maybe they're ready for a continuous flow, in which case you wouldn't count. You would go ahead and turn your flow control back on, staying in the green area, and just continue with the flow. Watching your clock, because every 6 seconds is a cup. So if they take a minute of water, they take 10 cups, which is a lot of water. Now at any time whether you're counting back from 6 or you're on a continuous flow like this, if they indicate the need to release the water, you do not turn off your flow control. You go straight to the empty cycle and increase your flow, because we've got something coming down from the stream to meet the river. And this way it will help flow it out through your device. Okay? When they're finished releasing and they feel calmer again, your flow control goes off completely before going to the fill cycle. Now, if you go to the fill cycle and you forget and you go to the full pressure, you're gushing water up into this client and they will be very uncomfortable. So this is not what you're going to do. When you're on the fill cycle, you stay in the green for that SheaWay, SloFil, and keep it gentle, like you see right here in the sink. Okay? I hope this is helpful. Proud of you gals and guys.